Welcome to our amazing channel, and today's topic is about the symptoms of kidney stones. Kidney stones, which are also named renal calculi, nephrolithiasis, or urolithiasis, are hard deposits of accumulated salts and minerals developed from inside your kidneys. Many causes will lead to the accumulation of these deposits, such as unhealthy diets, excess body weight, certain supplements and medications, or different medical conditions. Kidney stones cause a real load of discomfort as they can affect any part of your urinary tract, starting from your kidneys to your bladder. The main cause behind the formation of kidney stones is the minerals crystallization that happens when the urine becomes very concentrated. Kidney stones will not pass unnoticed, so let us start by stating the major symptoms before highlighting the different types of kidney stones, their causes, and how they can be treated. When the kidney stone reaches the ureters, it might block the flow of urine and lead the kidney to swell and the ureter to spasm. This will be very painful, and the symptoms you will feel are burning sensation when urinating, pain that comes in different waves and varies occasionally, pain that will radiate to the lower abdomen, below your ribs, mostly in the sides and the back. Aside from the pain, many alarming signs can indicate you have kidney stones, as a foul-smelling urine, reddish or brownish urine, nausea feeling accompanied by vomiting at times, persistent need to urinate, more often than usual and in small amounts, chills and fever. People who have kidney stones will often feel a pain that is changing, as if it is coming from different locations. That is due to the fact that kidney stones are moving through the urinary tract. The factors and causes that increase your risk of developing kidney stones include family history. You are more likely to develop kidney stones if someone in your family has had them before. You are also at increased risk of developing another kidney stone if you have already had one. Dehydration. Kidney stones risk increase every day you do not drink enough water. People living in warm and dry climates may be at higher risk than others. Obesity. High body mass index, large waist size, and weight gain have been linked to an increased risk of kidney stones. Certain diets. When you consuming a diet that's high in protein, sodium, and sugar, you are increasing the risk of developing some types of kidney stones. Too much salt in your diet also increases the amount of calcium your kidneys must filter, and this increases your risk of kidney stones. Certain supplements and medications, such as vitamin C, dietary supplements, increased use of laxatives, and certain medications used to treat migraines or depression, can increase your risk of kidney stones. Digestive diseases and surgery, from which we mention gastric bypass, inflammatory bowel disease, or chronic diarrhea, might cause changes in the digestive process. This change might affect your absorption of calcium and water, increasing the amounts of stone-forming substances in your urine. Other medical conditions, such as renal tubular acidosis, hyperparathyroidism, and repeated urinary tract infections, also can increase your risk of kidney stones. A passing kidney stone can be quite painful. However, kidney stones usually cause no permanent damage if they're recognized in a timely fashion, and if the right medical assistance was provided. In many cases, patients diagnosed with kidney stones are only required to drink lots of water to help the stone pass through the urinary tract, and to take medications to relieve the pain. In the cases where stones become lodged in the urinary tract, and are associated with a urinary infection, they might cause serious complications and a surgery may be needed. Your doctor may recommend preventive treatment to reduce your risk of recurrent kidney stones if you're at increased risk of developing them frequently. Not all kidney stones are alike, as they differ in type due to the initial cause that made them appear. There are 4 types of kidney stones. Calcium stones. Most kidney stones are calcium stones, usually in the form of calcium oxalate, which is a substance made daily by your liver or absorbed from your diet. Foods rich in vitamin D, metabolic disorders, and bypass surgeries increase the concentration of calcium or oxalate in urine. Uric acid stones. They develop in people who consume a high-protein diet or those who lose too much fluid because of chronic diarrhea or malabsorption. Different genetic factors also may increase your risk of uric acid stones. Cystine stones. They form in people with a hereditary disorder, making the kidneys excrete too much of a certain amino acid. Struvite stones. Struvite stones form following a urinary tract infection. These stones might grow and become large in a short period, sometimes with few to no warning symptoms. Your doctor will diagnose a kidney stone through a CT scan or an X-ray, a blood test, and a urine test before deciding on the treatment method and by assessing your overall health and the size and location of your stone. To prevent the formation of kidney stones, always make sure to follow a healthy diet, low in salt and rich in water, to help your kidney filter all the toxins. The most important part is to never ignore the symptoms and to seek the help of a professional. That was it for today. Hit the like button if you enjoyed the video, and do not forget to subscribe to the channel to never miss any of our informative videos. That was it for now. I wish you all good health and see you in the next video.